Good morning, everyone. I'm pleased to be joining you on traditional Treaty 6 territory and land that the Métis people share a very deep connection with. Albertans believe in our public health care system, and they deserve a strong system that they can rely on. But the UCP's severe mismanaging of the COVID-19 pandemic, their ongoing push to privatize services, and their sustained attack on frontline healthcare workers, because of these things, access to healthcare for Albertans is more compromised than ever. As of today, there are temporary bed closures or healthcare service reductions in more than 30 communities. Let's take a look at this map. North to south, we have closures in High Level, Fort Vermilion, Peace River, Fairview, Spirit River, Beaver Lodge, McLennan, High Prairie, Slave Lake, Wabasca, Swan Hills, Lac La Biche, Boyle, Cold Lake, Barhead, Whitecourt, St. Paul, Two Hills, Fort Saskatchewan, Drayton Valley, Wainwright, Hardisty, Rimbey, Rocky Mountain House, Sundre, Three Hills, Hanna, Drumheller, Airdrie, Calgary, and Bassano. These are all communities that are either short on doctors, nurses, healthcare professionals that support Alberta families and have reduced services for Alberta families, whether they need them for chronic illness or emergency care. And it's just one part of the healthcare story I'm hearing from families and frontline workers. Red alerts, times when there are no ambulances available, have exploded in both Edmonton and Calgary. We've used to have a handful of hours every month in 2019, adding up to a few minutes. This year, there are hundreds every month, adding up to dozens of hours of red alert. One of the main causes of this is ambulances getting stuck at overwhelmed hospitals, unable to hand off their patients. Last year, for the first time, ambulances in St. Albert, Spruce Grove, Fort Saskatchewan, and Strathcona County spent more time responding to calls in Edmonton than in their own communities. AHS data shows the percentage of Albertans who are discharged from the Royal Alec, the MIS, and the U of A within 4 hours is at the worst that it's been in 2 years. There is no one in the UCP leadership contest who is talking about this crisis in a serious way. Travis Taves didn't talk much last night about how in his own riding, there was no doctor at the Beaver Lodge Hospital ER while he was on the debate stage. I haven't heard Todd Lowen acknowledge the bed closures at health centers in Fairview, Spirit River, or McLennan. Brian Jean might care to know that Albertans cannot give birth or receive obstetrical care in Lac La Biche. And it's time that Rajan Sani and Rebecca Schultz take some responsibility for the South Calgary Health Centre turning patients away after 10 p.m. Despite all the blame and bluster, no one in the UCP has acknowledged that the root of this problem is their attack on healthcare professionals. They tore up contracts and threatened workers with pay cuts before and during a global pandemic. They chased family doctors out of the province, leaving hundreds of thousands of Albertans with nowhere to go except for emergency rooms. We need a new approach from a new government. An NDP government will bring real resources to the front line and restore a respectful relationship with healthcare professionals. We will ensure that Albertans can get the care they need where and when they need it. Thank you, and I'm happy to take questions about the crisis that we are facing today.
Thank you, Christina. For media joining us over the Zoom, to join the question queue, please press the raise hand button on Zoom. If you're joining us on the phone lines, it's *9 on your telephone keypad to join the question queue, but we'll start with questions from folks on the phone.
Thank you. Shailan Skalski with CTV News. Thank you for taking my question. I guess looking at the narrative coming out of the Health Ministry's office, it sounds quite different. You know, they're saying that the overcapacity measures that were introduced last week only lasted a number of days. They're saying that long weekend spikes in hospitalizations are nothing new, and that this is just something that we deal with, that hospitals really across the country are dealing with crunches from the pandemic, and Alberta is no different. What do you agree, or is Alberta's situation unique?
This is absolutely unique, and I disagree with how the UCP is trying to characterize this crisis. We have never seen closures in 30 communities across Alberta before. We have never seen the numbers that we are seeing in the AHS data coming out before. And it is uniquely because here in Alberta, we had a government that tore up contracts with doctors and gave themselves that ability, that threatened to fire frontline healthcare workers before and during a global health pandemic, and that continues to not acknowledge how serious and how deeply affected Albertans are from this crisis. We also have a government that's incredibly focused on their own political future, and in the leadership candidates, they are not talking about the healthcare failures in their own ridings. Instead, we hear rhetoric about introducing more chaos to our healthcare systems, rather than talking about supporting frontline healthcare workers, having a respectful relationship, providing more resources, and making sure that Albertans can get the care when and where they need it.
Yeah, just as a follow-up, you talk about bringing real resources to the front line, something that your government or your party would do within government. What are those real resources? Are you committing to a specific dollar amount in terms of a raise that you would give those frontline workers? Are you committing to renegotiating? I know I've asked, a couple of different times of a couple of different members of the party, but what are the actual tangible things that you're willing to do to retain and recruit workers that we need in this province?
Absolutely. To tangibly retain and recruit workers, the absolute first thing that needs to happen is to make sure that frontline workers have a government that respects them, the work they do, and will not threaten, harass, tear up contracts. Removing the ability to tear up contracts would be an important first step. Beyond that, some of the tangible things the NDP opposition has already suggested that the UCP government has refused to do is to start fixing the EMS system by offering full-time contracts to part-timers, by making sure that they get off shift on time, by making sure that we're investing in harm prevention to address the drug poisoning crisis, and to respond to the calls from frontline healthcare workers for real mental health supports, given the burnout that they are facing after 2 years of pandemic and the stresses that they've been under. We keep hearing UCP leadership contestants talk about looking to other countries or reorganizing the healthcare system. We need resources in local hospitals in over 30 communities. We need a real plan now, today, on the ground, not more chaos and reorganization, which is what the UCP seems to be portraying. And I think a long way would be achieved if the UCP would acknowledge their own role in this crisis we are facing, because this is unique to Alberta. It is not something that has just happened. It is something they caused through repeated disrespect and actions to attack frontline healthcare workers, and Albertans see that.
Tom from Global News.
Yes.
What does it say to you that the vast majority of these dots on the map are in rural communities where they're going to have to travel a great distance to get the healthcare they need?
Absolutely. The additional travel time adds risk to the health and well-being of Alberta families. It also tells me that the representatives for those communities have not been talking about the healthcare failures that are happening in their own backyards. And we see this repeatedly even from UCP leadership contestants. We need to make sure that we are providing healthcare across Alberta when and where Albertans need it. And with a record more than 30 closures in communities across Alberta, certainly the NDP official opposition is extremely concerned about the health impacts this will have on Albertans. Women having to travel hours in order to deliver babies is not the healthcare system that Albertans want to have and deserve to have.
You keep talking about the war, the battle against healthcare workers. There's negotiated contracts now with nurses, with HSAA. They're in negotiations with physicians. Is it fair to continue to use the line that they're at war with healthcare workers?
So I speak directly to frontline healthcare workers on a regular basis. And I will tell you that frontline workers in all types of roles within our healthcare system continue to use the language to me that they feel disrespected, that they feel taken advantage of and neglected by this UCP government. We have seen the disrespectful way that this government has talked about frontline healthcare workers and the disrespectful way that they have been treated through the threatening of pay cuts to critical healthcare workers in our system. It's very, very frustrating. The government has left themselves the ability to still tear up contracts with doctors. We need to see a real relationship developed. We need to see trust built, because we are currently facing healthcare workers who are leaving Alberta to work in other places. And so certainly from frontline healthcare workers that I talk to, they still feel disrespected. They still feel like they have a government that they cannot trust, that does not have their backs. And with 30 healthcare closures across this province, a record number, I think the evidence is proving out that the UCP is not supporting the public healthcare system.
We'll go to the Zoom line. Question comes from Michelle Bellefontaine. Michelle, when your line's unmuted, go ahead.
Christina, I wanted to follow up on a question that Shayla just asked you. And again, other provinces are facing the same challenges with ERs being closed. You know, Ontario, we hear about it in BC. And I still fail to understand how you're going to solve this crisis when every province is dealing with healthcare, the shortages of healthcare workers. I mean, there's only a certain number of people you can draw from. So what exactly do you think that an NDP government could do to solve this?
No, thank you for the question, and I really want to emphasize how unique the challenges are here in Alberta, given the actions of the UCP government before and during the pandemic, because of the way they attacked frontline healthcare workers, doctors, and the way they continue to downplay the crisis that we're seeing in our healthcare system. We can address these by listening to frontline healthcare workers and responding to some of the very clear things that have been asked for. Everything from in the EMS system offering full-time contracts to part-time workers, making sure workers get off shift, making sure there are mental health supports for these workers. We are also not seeing any strategy to recruit and retrain frontline healthcare workers. This government is focused on its own political future, the infighting, the division. Now we have UCP leadership contestants talking about looking to other countries and revamping our healthcare system rather than making sure that the local hospital in Hardisty has an ER open when it's been closed for the last year. This government is neglecting to resolve the immediate issues that are happening in our healthcare system today, and they're continuing their pattern of disrespect and not working with frontline healthcare workers through everything from the language they use in the legislature when we are debating to how they approach negotiations with these groups.
Can we follow up, Michelle?
Yeah, I mean, Christina, you say that Alberta's problem is unique. It's not unique. I mean, everywhere in Canada is facing the same challenges with a lack of capacity. And I mean, you're saying that you're going to recruit and retain workers. Where are you going to recruit them from?
So certainly, Alberta's situation is unique. Right now, we've never seen 30 communities with healthcare closures. We have the highest times in 2 years right now for patients to be discharged from our major hospitals. And we need to start talking about the recruiting and retaining strategies that we can put in place. Right now, healthcare workers feel very strongly that the UCP government, the Alberta government, does not support the public healthcare system, does not support the work that they are doing. And we can be putting measures in place like supporting the mental health of frontline healthcare workers, like making sure that part-time contracts become full-time contracts by taking real concrete action that our frontline healthcare workers have been asking for. This government is throwing up its hands and saying we can't do anything and we need to introduce more chaos by reorganizing the healthcare system. I'm hearing that from UCP leadership contestants, when at the same time we have very specific needs that need to be addressed, that need to be looked at. We don't have a recruiting or retaining strategy in place. we could have that. It would make a real difference here in our province. And yet the UCP government is disrespectful, has tried to cut wages, has threatened to fire 11,000 frontline healthcare workers. Alberta was the only province in Canada that had a wildcat strike of healthcare workers during a global pandemic. Alberta is unique because the UCP government has been so aggressive and so disrespectful to healthcare workers, and we cannot ignore the impact that that has had in what we are seeing today.
Now, next question comes from Jack Frill. Jack, when your line's unmuted, go ahead and ask your question.
Hi, I'm with the St. Albert Gazette. You were talking a little bit about women and just couples having to travel to deliver babies, and I guess I wanted to give you a first-hand story of that, of a couple I interviewed from Bonnyville earlier this week. This woman, her name is Sarah Collins, she was told 3 weeks before her baby was due that she'd have to find a new hospital to give birth in. And due to the family's financial constraints, they're not actually able to come to St. Albert until 2 days before the baby's due, and they're staying in a hotel. And like, luckily for this family, and their own words, you know, they're very blessed, and they have some extended family from Ontario that can come help them for the 2 days. But they're very concerned about how this may, like, the closures may affect families that aren't as fortunate as they are. And she's very concerned that we're going to start seeing, like, you know, like adverse events with families giving birth. And I kind of just want to know, like, what do you say to people like that going through that situation and that experience?
Oh, thank you so much for that story. And that is one family. That is one mom who needs to give birth in this province that's experiencing these kinds of delays. When we look at this map of more than 30 communities, we know that there are thousands of these families and stories, and not everyone is able to weather the financial burden. And not everyone is going to get the health care that they need because of the delays, because of the closures that are happening in our province right now. And to those families, I would say that they deserve to have the health care there to support them when and where they need it, and that we need at this point a new approach and a new government. An NDP government that will support public health care, put the resources in, rebuild the relationship with frontline workers, and it should not be happening this way. So I appreciate you sharing that story, because when we see the map, it's really important to remember that these are Alberta families that are being impacted by this crisis.
Follow-up, Jack?
Yeah, I guess I'm a bit curious about if the NDP has essentially like a game plan for the next year or so before the actual election of what the party's going to be trying to do to, you know, improve this situation. Like, if the election's about a year away or so, you know, that's people that are going to get pregnant and give birth before the election. Like, there's a long time, and there's a lot of situations that can happen like this one. Does the NDP kind of have a plan for the next year or so about how they can kind of fight to improve this?
Absolutely, thank you. Being here today and trying to highlight the crisis that the system is in and making sure that Albertans see what is happening is an important priority for us, because the UCP government is essentially saying, there's not a problem here. Oh, this is happening everywhere. And that is not true. It's not correct. We need to be talking about the immediate solutions that can be put in place, and we will continue to put pressure on the UCP government to take action now, to take their focus off their own political futures and start investing in the public healthcare system that Albertans rely on and need now. You have seen our health critic, David Shepherd, relentlessly pursuing the UCP government and all of the steps they can and should have been taking through the pandemic. We are going to continue to be talking about these issues, because when the UCP government tries to dodge this responsibility, it's Albertans who feel the impact. And so we're going to keep talking about those solutions and making sure that Albertans know they have a real choice when the next election comes, because there can be a government that supports public health care, respectful relationships with frontline workers, and continues to support their health when and where they need it.
Next question comes from Kevin Berger. Kevin, when your line's unmuted, go ahead. Oh, Kevin, you may want to check your audio. Okay, we may have to give you a call back, Kevin. We can't seem to hear you. We'll follow up after this. We'll go to Catherine Grakowski. Catherine, go ahead.
I do want to follow up on what some of my colleagues have said about this not being a unique problem. For example, in BC, they have promised a healthcare human resources plan, but in the meantime, at least 2 people have died waiting in local ERs where they're in hospital emergency rooms where their local ER was closed and no ambulances were available. Ditto in Ontario. So while we're competing for all these healthcare workers, what is going to set Alberta's recruitment and retention strategy apart? What does the province need to do in that recruitment and retention strategy to workers when there is this demand across the country?
No, thank you so much for that question. Right now, the UCP government is not talking about the need to have a recruitment and retention strategy. They are not addressing this crisis, and that is one of the actions that we are calling for in talking about the closures in 30 communities around our province, in talking about the impact women having to travel to deliver their babies is having. We need to see a government that is going to focus on resolving the crisis in their communities, because these are communities that the UCP in many cases represent. UCP leadership contestants represent areas where there are ER closures, where there are services that are not available. And yet we do not hear them speaking about this or pushing this government to make sure that they are there at the table with new recruitment, new retention, making sure that there's resources available in the system. That's one of the reasons why we are here today, to highlight the crisis that is happening, to demand action from the UCP government, and to talk about in the future the work that the NDP government would do. Everything from making sure part-time contracts become full-time contracts, that workers are respected and able to get off shift on time, that there's mental health supports for frontline workers. These are all things that workers care about, that are important to them and their own mental health, especially after 2 years of pandemic and the burnout that we are seeing. Instead, we have a government focused on their own political future, not talking about the crises in their own communities, and failing to support Albertans getting the healthcare when and where they need.
New follow-up, Catherine?
Yeah, and so premiers have been pretty united in their ask to increase money from the federal government. Does there need to be a national strategy to address this so provinces are not poaching each other's healthcare workers?
I think a national strategy absolutely should be part of any solution. I think Alberta needs to be at the table and working with partners to address some of the longer term challenges that we're seeing. And I'm very concerned about this UCP government being focused on its own political future and not accurately and adequately talking about the 30 closures that we're experiencing today. Not talking about the ERs that are not open today, the ERs that have been closed for a year. But yes, certainly I think when we're talking about what's happening in healthcare in Alberta, we do need to be part of the national conversation as well.
Thanks, Catherine. We're just going to give Kevin, try you again. Kevin Berger, go ahead. Okay, Kevin, we'll give you a call after this concludes. Seeing no further questions, I think we'll wrap up today. Thank you very much, everyone.
Thank you very much.
Thank you so much for watching, and to learn more, check out albertasfuture.ca.